Hello, everyone, and welcome to our talk show on hypnotherapy in regards to the World Hypnosis Day 2021. We hope that with this video, we can create more awareness about hypnotherapy and reach out to help more people. My name is Afika, and I will be the moderator for tonight's event. So, joining us today are six hypnotherapists that are the members of Association of Hypnotherapy Practitioners Malaysia. The AHPM itself is a body where they uphold a high standard of practice to ensure the safety of the public. So these hypnotherapists, in order for them to become a member of the AHPM, they have to attend briefings held by the Traditional and Complementary Medicine Division of the Ministry of Health. Aside from that, practitioners also have to adhere to a strict code of ethics and subscribe to professional indemnitary insurance. So now we have six speakers, and I will briefly introduce each of them. The first one we have is Mr. Isaac Lim, who specializes in energy emotional freedom technique. And we also have Mr. Hiro Koo, who specializes on doing clinical hypnosis for medically unexplained symptoms. And the next speaker is Ms. Thevi Sinnadurai, who will explain to us a bit of an observation on the hypnotic state and its induction and utilization of the hypnotherapy. Afterwards, we have Mr. Muniandy Ramachandran, who will explain to us how hypnotherapy through past life regression and spirit releasement works. And then we have Ms. Thingal Thiagarajan, who will do hypnosis for coping with grief and loss and explain to us how she would navigate us through grief. And lastly, we have Ms. Joyce Hugh, who will explain how she utilizes hypnosis to treat anxiety and depression. So now we will make sure that these practitioners that are specialized in their own fields to come on and share a bit of what they do to us. So these practitioners have assisted many people based on the techniques that they use. In hypnotherapy, one technique does not usually fit well, so it is very important that you find the right practitioner and the right therapists that can cater to your issues. Please remember that hypnosis is not about control, but rather it is about cooperation. So, apart from that, it is important that you find a therapist that you are comfortable sharing your problems and comfortable speaking with. So, now we are ready to move on to our main session. Let me welcome Mr. Isaac Lim to start with his session. Second. All right.
Hi everyone, I'm Isaac Lim of Energy Psychology Center. My office is in PJ, but I do online too. I specialize in emotional freedom techniques and have been conducting therapies and trainings for the past 18 years. I'm a certified trainer for UK-based Guild of Energies and teaching energy EFT, energy motion, modern stress management, and other techniques to help people. I'm also certified practitioner in hypnotherapy, medical qigong, and NLP. My passion is to help everyone learn to manage stress before it manages them. Now today I'm going to talk about energy EFT and how tapping into positive energy of hypnotic state. In energy psychology, we believe that emotions are just energy, that negative emotions are caused by a disruption in the body's energy system, and that sensations that you feel in your body are actually feedback that tells you of your energy state. Now, to explain the process, let me use a therapist client setting, where the client has issues with his father. If I ask the client to think of his father, I will ask him how do you feel? And where do you feel it? And the client will reply, I feel anger. I feel my heart palpitating and heat all over my face. And I then lead him to do a setup, to ask his subconscious mind to set an intention. I want to release this anger with my father. Then we tap on the sequence of acupressure points with our fingers, repeating the emotion, angry with my father, angry with my father, angry with my father. And the client will realize that his anger dissipated after tapping the sequence of acupressure point. It's a release and unblocking of the energy. We then ask the client to think again of his father. What do you feel now? And he says, I feel sad. And we continue to tap until all underlying negative emotions are gone. He feels relief as there's no negative emotions arising anymore. But feeling nothing is not good enough. Human experience is not feeling nothing, but enjoying positive emotions. We are supposed to feel happy, awesome, wonderful, and on top of the world. So to do that, we tap to install positive emotions. Ask the client, what positive emotion do you need to be able to relate to your father? And he replied, confidence. And we tap on that, and immediately he felt a surge of newfound confidence enough to talk with his father. We can add on more positive emotions, but we can also add on wonderful positive memories that he had with his father before falling out with him. Ask your energy mind, your subconscious, to give you a positive, happy memory about you and your father. A memory appears of the time he was 12 years old and his father took him fishing and taught him to fish. And both had an amazing and loving experience, a father and son bonding experience. I'll ask him, what lesson can you learn from that memory that will revive the relationship with your father? And so we learn from that experience. So by using a positive, we change the energy of the relationship. We can also deepen the experience of the positive memory by focusing on your six senses during the fishing memory. What time of day is it? What do you see around you? What do you smell? What do you taste? What do you feel on your skin? What inner emotion do you feel? Now, this brings us to a focused awareness, which is a hypnotic state. It becomes vivid and real. The end result is changing the energy of the relationship at a deep subconscious level by using positives rather than seeking for trauma after negative trauma. Now, let me recap with my slide, as you can see. And there we are using energy EFT and explaining the process of it. We believe that emotions are just energy. We remove the negative emotions by unblocking the energy system. We install positive emotions to change how they feel. We use clients' own positive memories for positive solutions, using the six senses to bring in hypnotic state to support the positive energy of the memory at deep subconscious level. The outcome, clients' feelings, thinking, and actions has changed positively with higher energy levels. If you need to know more, please go to www.goe.eftwonder.com. Thank you for listening.
Thank you so much, Mr. Isaac. That was such a mindful session, and how you explain using energy EFT and tapping into that positive energy in order to change the emotions that the client has with their own father, in order to make sure that it turns out positive at this deep subconscious level of their memory. Thank you so much, Mr. Isaac.
Thank you.
Now we will move on to our next speaker, which is Mr. Hiro, who will explain to us what he does and how hypnotherapy assists that. Mr. Hiro?
Hi everyone, my name is Hiro Koo. I'm a clinical hypnotherapist practice at New My Brain Health Center at the Bangsa South. So basically today, my topic is about how hypnotherapy can help for medical unexplained symptoms. So most of the clients who come to see me, mostly they are facing medical unexplained symptoms. For example, they might have some digestion issue, heart palpitation, breathing difficulty, like frequent urinate problem. All these things is quite common in my practice. I always see this kind of client who are facing such issue, and most of the time we will do a screening first to understand their brain, because through the brainwave screening we can actually understand how come they are facing certain symptoms. For example, a person who are showing some traumatic related brainwave, they tend to have sleeping problem, they tend to have some nightmare, they even might have bodily discomfort feeling, because the brain somehow is closely related to our autonomic nervous system. When the autonomic nervous system is in a haywire state, most of the time our body tend to show a lot of different kind of symptoms. So for example, you can ask yourself, when I explain this, how do you feel about this world? And how do you feel about yourself emotionally? So if you look at the chat here, you can see that if your answer is like, oh, I feel connected to the world, I feel belong, high chances your autonomic nervous system in a much more calmer state. But if you say, I'm in the danger, I feel like I need to run away, I need a holiday, maybe you are in a sympathetic, which is a fight or flight mood. Or if you tell yourself that, you answer that, I feel lonely, I feel like I want to just live for a whole day, I don't want to do anything. Possible you are in a dorsal vagal, which is a free state. And free state normally is where the trauma store. Trauma normally store when a person in a state which is they feel helpless, powerless, and etc. That's why by using the brain mapping, somehow we can understand a person's unconscious mind in a better way. Because all these unconscious process is not just like a marketing gimmick. It's not like that. Actually, unconscious process is a real science. As you go through the research, you can find that unconscious process is real. That's why imagine a person know that smoking is unhealthy. But why they're still smoking? Because there's certain unconscious process affecting them. That's why through the brain mapping, after we assess a person's brainwave, we are going to see different kind of pattern. If let's say we notice that there's some trauma-related pattern, or let's say we found that client having some rumination in the brainwave showing some rumination pattern, we can utilize a technique such as cognitive behavioral hypnotherapy method to work on the mindset to help them to form a more helpful belief. Or if we found that the client actually went through some trauma and made them go into a free state, which is a dorsal vagal unhealthy state, then we can using the trauma-informed method to help them to deal with the trauma by making the body free from the freeze and trauma state or the rumination state. Normally, the symptom of the body, for example, pain, digestion problem, breathing difficulty, normally will getting better and better. That's why hypnosis is an evidence-based practice. Hypnotherapy can combine with so much of different psychological therapies to help a person to be healthy again. And last question, have you ever think when you are sick, you go for X-ray, body scan, but how about your emotion? How about your psychological symptom? Have you ever scanned your brain to understand how they look like? So maybe this is something that you can consider using a neuroscience method to look into your unconscious mind. So I hope my presentation today will help you guys to have a new idea about how the unconscious shape our world. Thank you.
All right. Thank you so much, Mr. Hiro, for your wonderful sharing session, and in which we can, now learn more on how hypnosis can be used to help explain symptoms that are shown physically, physiologically, but not psychologically, and how through this method we can now identify more resources on how to stop this problem or achieve a more calmer state of mind from reaching that sympathetic fight or flight symptom. All right, now we will move on to our next speaker, which is Miss Thevi Sinnadurai. Miss Thevi, whenever you're ready.
Yes. Good evening, everybody. We've had two wonderful speakers there who spoke about the techniques. And okay, before I go into further details, I'm Thevi Sinnadurai. I'm a trainer and a therapist who uses various eclectic modules to work with clients, to work on behavior changes, emotional enhancement, resolving issues. And today I'm going to speak a little bit on observations of hypnotic state, its induction and utilization. Before I continue with that, let me give you a different perspective of what hypnosis is as a description. Hypnosis is a social interaction and interpersonal relationship in which one subject, that is your client, responds to suggestions offered by another person designated as the hypnotherapist or hypnotist for imaginative experiences involving alterations in conscious perception and memory and the voluntary control of action. So this speaks a lot. So there are four basic observations to be followed to induce a hypnotic trance by a therapist, hypnotherapist. So let's look at the first stage, which speaks about absorbed attention. When we talk about absorbed attention, it is simply capturing the attention and focus of your client. And that stage is a stage where you build this interpersonal relationship, and in other words, you may call it rapport. And while that is being done, you bring in that induction, which is basically eye closure. And it is really very interesting why you work with eye closure here. You see, neuroscientist Andrew Hubert had said that the mind and spinal cord, the brain and the spinal cord is connected with the body. And they are all internal. But very interestingly, there are two parts of a human being which is connected to the brain, which is your eyes. And in hypnosis, there's a lot of neural activity taking place in the dorsal anterior cingulate cortex. Basically, it's a prefrontal area. So the eyes being connected to the brain, achieving eye closure during induction brings about the start of hypnosis. And that is really very interesting. It's a new research that is done by Andrew Hubert in the Stanford University. He's a neuroscientist. Okay, once that is achieved, then the hypnotherapist goes to the next stage where you need to bypass the critical faculty. This is where you bring in deepness. You speak about a countdown, 1 to 10, or perhaps going down a staircase. And when this takes place, your client is going into a deeper state. So you're engaging them into another response where they are in this unconscious response. You activate that. And another research shows that there are connections taking place here. The dorsal, lateral, prefrontal cortex, insula, all these are parts of your brain. And hypnosis plays a huge part here. Like Hiro said, taking those scans of your brain shows distorted activities. So likewise, doing these research work from the brain tells us how important hypnosis plays a part here. Once all this is achieved, then there you go, leading the unconscious to a desired outcome. And this is where the client is ready to do therapy work of suggestions and metaphors. Isn't that amazing how these 4 stages are so essential? So when a hypnotherapist achieves these 4 stages, then the outcome, the results in the client's being is more resourceful in overcoming their issues and their problems. So successfully, when the therapist combines all 4 stages, both the client and hypnotherapist are engaging in a hypnotic interaction, and the client becomes more resourceful in overcoming their problems and challenges. And this, I hope, gives you a better understanding. This is a newer way of looking at the stages, and I hope this gives you a better understanding of the whole process of hypnotherapy. Thank you very much. I'm Thevi again from Thevi's Way, which is my brand that I just created in bringing in therapy work to you. So thank you very much. Have a lovely evening.
Thank you so much, Ms. Thevi, for such an informative sharing session. Ms. Thevi just explained to us basically how the biological state of the brain looks during induction and utilization of hypnotherapy, in which these 4 stages will lead the hypnotherapist to guide their clients into achieving whatever outcome that they want to achieve, to solve their problems and overcome their challenges in life using hypnotherapy. That was great. And now we will move on to our next speaker, which is Ms. Thingal Thiagarajan. Oh, no, I'm sorry, excuse me. Our next speaker will be Mr. Muniandy Ramachandran that will explain to us about past life regression. So Mr. Muniandy, if you will.
Thank you so much for the introduction, Africa. So hi, everyone. Thank you for visiting our site and welcome to the World Hypnotic Day Talk. I am Muniandy Ramachandran. I'm a hypnotherapist as well as a budding psychologist in training. I am American Board of Hypnotherapy certified hypnotherapist, and I run my own center in KL for the past 5 years. My information is at the bottom of the slide. So my area of specialty is regression therapy, even though I do many other forms of eclectic therapy. So today I will just focus on regression therapy. So what is regression therapy? Regression therapy is a form of hypnotherapy that where we take a client as regression, meaning going backwards in time, these clients are taken back to a significant or traumatic event earlier in their lifetime in order to access any unprocessed memories related to a trauma that they experience that seem to have a link to their present time and affecting their present functioning. It is a psychologically safe therapy involving the body and mind, which are reprocessed under hypnosis. So let me just briefly go through the slide and then I can go into detail. The process of regression basically is a gentle way where you take a client under hypnosis, very well covered by Thevi just now, to re-experience an older repressed memory. And in order to reprocess this old unconscious emotional trauma in such a way that they can be disengaged, and then the inappropriate to disengage the inappropriate emotional trauma and response. And this is believed in this hypothesis that this actually reconfigures the brain circuitry. Much more research is needed in this area. So a lot of the success that in my setup and internationally is from actually anecdotally recorded, as well as experientially shown by clients. So, and the process, the objective is for the older infantile, meaning childhood aspect, which are immature, which are unproductive, automatic, unconscious, and dysfunctional response of the client are disengaged and then is replaced with a more healthier and more functionally appropriate suggestions and beliefs in order for the client to heal and function better individually and socially. So the three regression modes that I use is called age regression, past life regression, and life between life regression. The other related modalities, which I won't touch here today, is called spirit releasement, which is basically people feel there is some spirit inside of them, or some dark energetic entities, a sense of something dark and sinister is within them. Just to give an overall picture here, at least in my setting, I take all these issues as psychological issues. So even when I mention about past life regression, it is still a psychological phenomena. A belief in past life regression is not needed. In fact, the experience of past life regression is only a tool in order to support and help and progress in the current life. It's not for a past life. It's not a standalone thing for some grand understanding of religious aspects or what, but it's more for therapy and more for purpose of healing and to bring the person to the present. Now, and life between life is more an aspect where you it's a life between two past lives. There's a time in between that, right? I won't go into detail there. I've got 5 minutes, so I will wrap up quickly. So who will benefit? So basically people who will benefit are people who have ability to use their senses very acutely. Basically they can visualize well, hear and feel well. And also people who are very receptive to suggestions and can follow suggestions and compliance. They will benefit very, very much in this. So what are the benefits? So basically the major benefit is you can desensitize your unknown fear that is basically operating within you without your knowledge by going back in time and facing and experiencing them in a safe environment under competent supervision and environment, right? And this process also brings about forgiveness both for self and others in terms of shame and guilt. Some, for example, a sexual molestation experienced by a child, when they re-experience it and they realize this is something in the past, it is real, but it's still in the past. So they can bring them up and experience, and more importantly, the self forgiveness that comes about it. What else comes out from here? You can also bring out certain strength. In a past life regression, you experience, let's say, a life of a warrior. So people who are meek and lack of confidence, they can see a life where they've been a warrior fighting in the battleground, right? So they can bring these experiences back into their present life because they've fought, right? Even though they don't believe what they see, but the experience of it can be incorporated in post-suggestion, during at the end of hypnosis for them to reincorporate that into their system. And also they can bring about new understanding, wisdom, and mental resources from the past, in a past life, right? And in a past life also you experience a loss due to death. So those who are very anxious about future and death, they can experience it. And also they see themselves in a larger picture, more than the limited thing they see themselves. In a past life experience, they actually see they're much larger. Spiritual awakening can happen, they can understand, but spiritual, religious doctrines are not needed. You don't have to believe in a past life, but it helps support a grander vision of a bigger, holistic life. So my time's up. So I will wrap up here, and thank you for listening. And there's the question and answer session. Please wait till the end. Thank you.
All right. Thank you so much for your very informative and wonderful sharing session, in which the audience can now learn that hypnosis using for past life regression or age regression that takes us to re-access and reprocess our older repressed memories and maybe some unconscious emotional traumas that are buried within, and how reprocessing all of that can help us overcome the current traumas that we have in life. Maybe something that we subconsciously handle all the time, but now that we are more aware of it, we know where to go in order to not um, suffer from the same trauma now, and or using the more positive aspects of the past experience in order to make you into a better person now. Thank you so much for that. And now we will move on to our next speaker, Ms. Thingal Thiagarajan, to share us how she uses hypnosis to cope with grief and loss. If you will, Ms. Thingal.
Yeah. Thank you, Africa. Hi. So I'm going to touch on hypnosis for coping with grief and loss. So the reason why I chose this topic is because lately been coming across people, trying to cope with grief and loss, especially during this pandemic. We have been losing a lot of people, close ones. So I'm just going to touch on a few points, main 3 points that I'm going to touch on. The first one would be the stages of grief, and then we are going to tap into how hypnotherapy would be, helpful for you, and how you can come out or cope with your grief and loss. So I'm going to move further with the stages of grief. So usually, grief, when you're facing this grief stage, we tend to suppress our feelings, thinking that, if I flush it down with food and I'm gonna make myself busy, I'm gonna be fine with it. I have a lot of clients coming to me saying that I've been feeling down, but I'm okay now because I've gotten myself very busy with my work. I tend to eat a lot, and food makes me happy. But again, it's very important for you to acknowledge your feelings and emotions that you are facing, because those are indications or signal that your body is giving you that you should be attending to your emotions. It is very important that you acknowledge each and every emotion of yours. It can be happiness, it can be sadness, it can be even anger. It's very important for us to feel everything that we are feeling, especially when it's grief. It is important for you to acknowledge them and go through the process thoroughly so that it doesn't backfire later part. I have a client who came to me saying that I lost my mom a few years back, and I was fine, but I went to work on the same day, after attending her funeral, and I was all fine. I did not cry. But then after 2 years or 3 years, suddenly she had this breakdown. She started having the skin symptoms, eczema and all that, and she said that she don't know why she was having it. So these are actually those emotions that she has suppressed, which later came out in a different form. So, stages of grief. The first one is denial. Let's take breakup, for instance. So, when you go through a breakup, you first come across this denial phase whereby you deny that you cannot believe that this person has left you. And then moving on to the next stage would be usually anger. You're so angry that this person left you, whereby you don't actually process the situation or what has happened, but on the person itself. And third stage would be pain. Okay, so though I have laid out all these three stages, it can get mixed up. Sometimes it could be anger first, and then denial, and then pain, or the other way around. And usually when you come to the third stage, which is the pain, you would be coming across waves of pain whereby it somehow it recedes and then it becomes lesser and lesser. And then when you have gone through all these three stages, then comes this acceptance, whereby you tend to accept that you are going through this phase, and then after that you move on. So in the process of hypnotherapy, what we do as a hypnotherapist is that we lead back people to regress back to the original traumatic events and then tap into a more effective way. We give them opportunity to heal their emotions regarding the situation and finally let the grief go. And so that, the client no longer has to repress these strong emotions, and whereby later on, it backfires with physical or emotional pain that comes along. And this can be manifested by many ways, but it differs according to individual. But usually it's always the positive reinforcement and self-esteem technique in hypnosis, which is mostly helpful for the individuals. And during the process of hypnotherapy, we hypnotherapists would bring you into a deep relaxation state where we'll be tapping into your subconscious mind, where we help you to teach you how to focus and realign on the good thoughts and positivity. And remember, grief is not a permanent state of mind, but it's a process. And your feelings are the most real thing you have. And if you are somebody who's going through grief and you know someone who's going through grief and who requires help, please reach out. Do not go through this alone, because if it is important for you to handle your emotions in a more effective way, so that in future you'll be able to acknowledge all that you are feeling and lead a healthy life with positive mindset. Thank you.
All right, thank you so much for that, informative sharing on how hypnosis helps us cope with grief and loss. And I find it very important that what a hypnotherapist does in these sessions is guide the client in order for them to focus on the good thoughts and positivity and tend to their emotions in a more uh, careful or structured way and realign their emotions instead. This also will help us reduce the intensity of the grief and navigate our grief more gracefully in order to come out of it stronger and as a better person, because the ultimate goal is to move on from that and live a better life afterwards. So yeah, that was very wonderful. Now we will move on to our final guest speaker, Miss Joyce Hugh, who will explain to us a little bit on how she uses hypnotherapy and hypnosis to treat anxiety and depression.
Hi everyone, my name is Joyce. I'm a mind therapist. So I am a counseling psychologist. I focus on subconscious mind. So I also do clinical hypnotherapy, but I also do psychotherapy, counseling, EFT, EMDR, schema therapy as well, because I believe not one type of therapy fits for everyone. So it's best to sort of see the individual issues and try to put in the best technique for that particular client. So in the work that I do, I focus on anxiety and depression. So how does hypnotherapy actually help with these two issues? So first, I want to say that anxiety is about your future, depression is about your past. So one good example is about the COVID situation right now. So anxiety about it will be what's going to happen next year? Will the vaccine be okay? Will the world be back to normal? So if I'm overly worried about that, then I'm going to get into this anxiety mode. Or if based on this situation, I have depressive symptoms, means I'm thinking back about the time that I could fly without any restrictions. I could just meet my friend and give her a hug, but now that I can't, I feel very hopeless. So that means that depression is kicking in. So what can we actually do to help people with anxiety or depression? So in anxiety first, it's actually very effective with hypnosis because in 2019, they did a review of 15 studies and they concluded that hypnotherapy actually helped anxiety patients with an 84% more effectiveness than those who didn't receive it. So if you look at the world out there, almost everyone is suffering from anxiety, but they don't know how to get help. So I think it's very important that we actually reach out because in the world, as we look at it, there are a lot of things that we can't control. So if we focus on things that we can't control, like the COVID situation, we can't do anything about it. But what you can do instead is probably, as a tip, choose something that you can control, like the way I'm going to stay safe by staying indoors. So that's you being in control of yourself. Okay. But if things get a little bit out of hand, therapists will be able to help you with desensitization, slowly helping you to adjust to that stimulus. We can help you with schema modification, how you think of a particular issue. So for example, my schema of this virus is that it's deadly. Maybe I want to change the way I think about it, right? Imagery and visualization, maybe what I could do is try to ask you to visualize that you are calm, you are safe, you're in control. And we talked a lot about hypnotic suggestions. So that is where you tell us what you want, because in hypnosis, we are not the one that's in control. We can't put in things that you don't want. So if you say that you want to be confident and feel safe, then yes, we'll put that in as a suggestion to you as well. So these are some of the ways that we can help you when it comes to anxiety. But now thinking about depression is that majority of the people that I talk to, when they have depression, they would normally go to see a medical doctor to get some drugs, medical drugs that is. But these type of techniques, they only help you with symptom relief, helps you feel better and maybe cope better, but it doesn't quite get to the root cause of it. But please bear in mind, at times, medications are important as well, because if things are getting out of hand or if there are suicidal thoughts, then probably you might want to explore that. So once again, the treatment of your choice is really up to you. But in depression, using methods like hypnotherapy, what we would do is actually get to the root. So we'll put you into your subconscious mode. And from there, we try and talk to you and find out what the root cause is. Because my belief is that we all have something that probably triggers this emotion. It doesn't need to be one particular event, like maybe a breakup or someone's passing, but it could be an accumulation of emotions. Like, for example, how as a young girl, I constantly felt that I'm not good enough. So that will, of course, trigger, lead into how I feel today. So we'll get to root cause. We'll help you to manage that root cause as well. So that's where we'll help you with a bit of reassurance of the past. That's what Muniandy was talking about, regression. We'll help you with maybe a bit of forgiveness, or depending on your issue. Then, of course, after that, we'll teach you some self-coping strategies as well, because in hypnosis, it's not a long-term technique. What we'll do is we'll equip you with techniques so that you can help yourself. So I think that's a better way, because we are facilitators, we are not change agents, right? So once again, in depression, it's about looking at the past, and we can't control that, right? So another tip for you guys, try to look at what you can do right now. For example, I choose to get out of it, I choose to take action. So in hypnotherapy, just remember that you are the one that's doing all the work. And if you need help, just go out there and get help. Thank you. So back to you, Apika.
All right, thank you so much, Miss Joyce. The way that you summarized hypnotherapy and how you use it was very helpful. I'm sure to the audience, especially with how anxiety and depression are very valid problems nowadays. I think some of the key takeaways from that is that for anxiety, hypnosis can be used as some kind of a desensitization technique. So we expose our clients to the stimulus in order for them to get used to that and not be as affected by the stimulus as much. And also depression, in which hypnosis is used to aim for treating the triggers and the causes, in which usually medications don't do that enough, which I think would cause relapse most of the times for these patients. So with hypnotherapy, at least we can teach our clients to be more self-reliant afterwards, and they can help themselves to manage their triggers a bit better. So yeah, that was such a great session with our guest speakers. Thank you so much to all of our guest speakers. And now, finally, we will move on to our next and final section, in which we have compiled a few interesting questions via social media. After we ask them, what would people want to know about hypnotherapy? So hopefully we can get some of these mysteries solved with the help of our guest speakers today, of course. And the first question is, what is the difference between hypnotherapy and psychotherapy? And I would like to direct this question to first Ms. Joyce, and then we can also ask Ms. Thingal for her input as well. So Ms. Joyce, if you would.
I would say that hypnosis is actually a form of psychotherapy, because if you think about it, psychotherapy is just therapy done with psychological tools. So hypnosis is one of it. Counseling can be it as well. Clinical hypnotherapy, art therapy, all these other techniques that psychologists use, these would be called psychotherapy as well. But once again, like what I mentioned just now, there's no one technique suits all, but most important is that you choose what is best for you. Because some people may like to talk, some people may want to try and see things from different perspectives. So the choice is really yours. Choose a technique that's comfortable for you. So that's what I have to say.
So to just add on to what Joyce has said, usually hypnosis is an aid to psychotherapy, and usually because we tend to use hypnotic state, because that state allows you to explore or the subconscious mind, where to explore your painful thoughts, feelings, and memories that you have suppressed, and that state allows people to respond better to suggestion. So that's the difference between hypnotic and psychotherapy.
Thank you so much to Ms. Joyce and Ms. Thingal for their input to that question. I hope that explains the question on how, different or not so different hypnotherapy and psychotherapy are. And now we will move on to our second question, which is can a person actually lose their ability to be in control and follow just whatever a hypnotherapist suggests during a hypnotherapy session? And for this question, I would like to direct it to Ms. Thevi and Mr. Isaac to answer it. So, Ms. Thevi, if you will.
Yeah, very good question, because this is something that most clients and people want to know, whether control is taken over by the therapist. What is important in a hypnotherapy session is about like I mentioned earlier, the interpersonal relationship. And in this relationship, there's a lot of trust that is created. There is this relationship of permission to facilitate and use hypnosis as explanation on hypnosis. So once this is established between the client and the therapist, then that demystification is taken off, that would I be controlled? And then the issue of trust. It's not an issue, the element of trust comes in, and the therapy session then becomes a good one. Okay. And maybe Isaac can explain a little more too.
Well, it's important to remember hypnosis is a willing state. You cannot be hypnotized against your will. And working with a hypnotherapist is a mutually creative process. The most common reason for failure to induce a hypnotic state is a lack of rapport with a hypnotherapist. And that is why there's a need to check the rapport and willingness by testing for suggestibility. Just by having this question in mind will likely stop you from being hypnotized because you are already anxious about losing control.
Okay, thank you so much for a brilliant answers to that question, Ms. Devi and also Mr. Isaac. And now onwards to our final and third question. What are some of the potential side effects of a hypnotherapy session? And for this question specifically, I would like to direct it to Mr. Hiro and also Mr. Muniandy. So Mr. Hiro, if you will.
Okay, so basically, hypnotherapy is generally safe. So unless a person might have some psychotic issue, or like, for example, schizophrenia or delusional disorder, if you're having such issue, it's very important not only work with hypnotherapy, but also work along with other professions like psychiatric. If you work along with other professions, then the side effect normally will be minimum. And most of the time, people actually misunderstood every reaction as the side effect. But actually, every reaction is quite useful during trauma or regression work. Can be something which is very powerful in order to facilitate change. That's why it is very important for therapists to provide a sufficient psychoeducation to let us understand what is the every reaction and don't misunderstand it as a side effect. Maybe Muniandy can further elaborate on this part.
Thanks, Hiro. Thanks, Apika. Okay, so three areas that Mr. Hiro raised is about the app reaction. App reaction is basically the emotional and physical, excessive vocal, emotional, physical movement during a deep hypnosis session. Because the client under a very deep hypnotic state would be basically experiencing what they see, hear, and feel as though it's happening actually is happening to them at that moment. So whether it's a remembered event, or it just just a situation, or an image, or that has just arisen spontaneously. They have not seen this, but it's arising. It could freak people out, but this is rare, and well trained. Most of us are well trained. Well trained people will not take the client to that stage, or even if it happens occasionally, they would know how to safely bring them out, particularly during the emerging session, or when they're coming out during the awakening process, because it's a phenomena that can happen. And in particular, in my kind of work that I do, which is the fringe area, regression therapy, and the more exotic area of past life regression and life between life, the client do actually experience images, visions, with the full sensory aspects of something something that's happening they've not experienced before. And it's very useful tool in the area of my work, app reaction. It's a useful tool for reprocessing and reducing and to desensitize trapped or hidden issues that's within us, past traumas and all that, right? So it has got its benefit depending on the type of modality that's being used. In my area, app reaction is a success, meaning they go through and they re-experience, and then they calm down, and then they go into the acceptance and forgiveness, and it brings out a lot of wisdoms out of it. But in other aspects, the mainstream hypnotherapy, the therapists normally do not bring them into this area because it's not needed. There are other ways of dealing with it, and therefore it's not necessary. So it's not really a side effect that's permanent. It's just that in the clinical, the room, it happens, and with proper emerging and awakening process, they can be made to calm themselves down, drink and settle down, and take their time before they wake up, and eventually they are back into the room and feeling the sensation, and they realize whatever happened is just something that happened, but they are back to the real life and to the real living moment, and therefore they could now understand it retrospectively and see what happened in a more calm and collected and more in a wise way. So this is not side effect, depends on the therapy, but they will no one carries it over permanently. There's no permanent things. People will lose, even if it's for 1 hour, it's there. They will come out of it in a matter of time, So it's not really a bad thing, depending on the therapy. That's all my take on it. Thank you. And just the last take. So something that Hiro also touched on is that, so it's not any kind of therapy. I wouldn't particularly mind. It's not a standalone therapy. It's a complement, supportive, and in conjunction with several therapies, right? It could be, as what Joyce mentioned, there are a lot of psychotherapy techniques, and also we can use psychiatric help. So most clients who are experiencing a certain kind of, say sadness or anxiety, they fall in a spectrum of clinical symptoms, right? So every help is useful. So we shouldn't just take it as a silo and stand alone kind of treatment, but use it and complement it with energy healing, with talk therapy, with psychotherapy, with the many types of psychotherapies are there. Plus, if very serious cases of psychosis that Hiro raised, you definitely need to see a psychiatrist, because with deep psychosis, you may not even be a suitable candidate for hypnotherapy, because there is a certain segments of population which may not be suitable, and one of them is those with severe schizophrenia and serious psychosis. Thank you.
All right. Thank you so much for the extensive sharing session on the third question. It is a really interesting question. So yeah, overall, so much was shared about hypnosis and hypnotherapy, and I really hope from what we have managed to gather so far in this video that the public can benefit from this sharing and maybe more interested in learning about hypnotherapy on their own time. So if you would like to know more about hypnotherapy and their specific areas according to our practitioners' specialized fields, please feel free to contact them individually according to their contact information that was featured on their individual slides in this video. And yeah, I hope you guys will have a good day, and thank you so much for viewing this video. Thank you.